study about health. Health is a social infrastructure and health is always considered as absence of disease. Okay, health is not only absence of disease but also the ability to realize one's potential. Okay, then health is always considered as absence of disease. In reality, health is not only absence of disease, it is well-being of people, which helps the people to increase their efficiency, realize their actual capability and to perform to their fullest capacity. It is easy to ascertain health level of the people by taking the indicators such as infant mortality, maternal mortality rate, life expectancy rate, nutritional levels. Okay, then these are the main factors, these are the main indicators of health. Okay, then development of health infrastructure ensures a country healthy manpower for the production of goods and services. Okay, then availability and accessibility of health infrastructure to all people is very important. Then the central government, we know central government have an important role in the development of health infrastructure. We know the central government formulates broad policies and plans through Central Council of Health and Family Welfare. Okay, the CCHFW collects information and provides financial and technological support to state government. Okay, India has built up a huge health infrastructure and human resources at different levels. Then, if you are taking state health infrastructure, you can see here on table hospitals in 1951 it was 2654 in government field. In 2017 you can see it is 25,778. Okay, in the case of beds in government hospital, it was 1,17,000. Now it's 7,13,000 something. Okay, in the case of dispensaries, it is 6,600. Now it is 27,951. PHCs, it is 25,743. Sub-centers, it is 1,58,000. Then CHC, Community Health Centers, it is 5,624. Okay. Then after independence, there has been a major development in terms of health service. Okay. Then we know this growth rate. By this growth rate, we can understand that there is a major development in this field. Okay. Then what is the role of private sector in health infrastructure? Okay, the public health sector has not been so successful in delivering health service. The private sector has achieved a remarkable growth in India. More than 70% of hospitals are run by private sectors. It provides 40% of beds for inpatients IP, and nearly 60% of dispensaries are run by private doctors. Okay, means we know they provide healthcare for 80% of outpatients and 46% of inpatients. Okay, then as a consequence of, we know, liberalization, privatization, globalization, as a consequence of this one, then industrialists and pharmaceutical companies and NRIs have set up super specialty, multi-specialty hospitals in our country. They provide services. Then in India's health system, three-tier system was there, like primary, secondary and tertiary. Primary health care includes education concerning prevailing health problems and methods of identifying, preventing, controlling them, promotion of food supply, proper nutrition and adequate supply of water, basic sanitation, maternal and child health care. These are coming under this primary health care. Okay. Then auxiliary nursing midwife is the first person who provides primary health care in rural areas. And hospitals, we know in rural areas very less number of hospitals are there. Then we know they are known as primary health centers, community health centers and sub-centers. When the condition of a patient is not managed by PHCs, they are referred to secondary, tertiary hospitals. Hospitals which have better facilities for surgery, X-ray, then ECG are called secondary healthcare institution. They function both as primary healthcare and also provide better healthcare facilities. They are mostly located in district headquarters and in big towns. Okay. Then all those hospitals will have advanced facilities like equipments, medicines and undertake all the complicated health problems which could not be managed by primary and secondary hospital come under the tertiary sector. Tertiary sector includes premier institutes like All India Institute of Medical Science, AIIMS. Okay. Then Postgraduate Institute of Chandigarh, then Jawaharlal Nehru Institute of Postgraduate Medical Institution, Education and Research in Pondicherry, then National Institute of Mental Health and Neuroscience in Bangalore, NIMHANS. Okay, these are the tertiary sector hospitals. Okay, then like that, about medical tourism also. What is medical tourism? I think you people already heard about this one. Means India's health service combine latest medical technologies with qualified professionals and are cheaper for foreigners as compared to cost of similar healthcare service in their own countries. In 2016, as many as near to 2 lakh foreigners visited India for medical treatment. Okay, then as this figure likely increase by 15% each year, experts predict that by 2020 India could earn more than 500 billion rupees a year though such a medical tourism. Then community non-profit organization, we know like Seva, like that some organizations are working for this health facilities. Then indicators of health in India with other countries 2016 and 18. Infant mortality rate 1000 live births, India it is 30, China it is 7.4, USA it is 5.6 and Sri Lanka it is 6.4. Means live births, infant mortality rate, that one it is 30. In India it is 30. Then in infant mortality we are calculating the death of young children within age of 1. Okay, it's around 30. And under 5 mortality is 37 in India, China it is 8.6 and USA it is 6.5 and Sri Lanka it is 7.4. Okay, then birth by skilled attendance, that one it is 81 in India, China it is 81, then 99 in USA, 99 in Sri Lanka. Then infants in immunization, that one is 89 in India, China 89, USA 94, Sri Lanka it is 99. Government health spending 3.7 in India, China it is 5.7, USA 17%, and it is Sri Lanka it is 3.9. Then out of pocket expenditure as a percentage of current expenditure, it is 65% in India, China it is 36, then USA it is 11, and Sri Lanka it is 50. Okay, these are the comparison with other countries. Then Indian system of medicines, it includes 6 systems: Ayurveda, Yoga, Unani, Siddha, Naturopathy and Homeopathy. Together we are calling as Ayush. Ayurveda, Yoga, Unani, Siddha, Naturopathy and Homeopathy. We are calling it as Ayush. Okay. At present, there are 4,095 Ayush hospitals and 27,951 dispensaries and as many as 8 lakh registered practitioners in India. But little has been done to set up a framework to standardize education or to promote research. Okay. Then ISMS means Indian System of Medical Science have huge potential and can solve a large part of our healthcare problems because they are effective, safe and inexpensive. Okay. Then the effort to set up a framework for ISM is very effective in solving our healthcare problems and they are also inexpensive. Okay. As we know, economists state that there is a greater scope for the role of government in everywhere in the health sector. In India, government expenditure in the health sector is very low compared to other developed countries. Okay. Then in our country every year approximately 5 lakh children die of waterborne diseases and communicable diseases. A study points out that doctors are available in PHCs as required in only 38% and only 30% of PHCs having sufficient medicine stock and less than 20% of our population is making use of public healthcare facilities. Next one is health infrastructure in urban and rural areas. Though 70% of India's population lives in rural areas, only 1/5 of its hospitals are located in rural areas. Rural India has only about half of the number of dispensaries. Then 70% of population lives in rural areas and only 1/5 of its hospitals are located in rural areas. About 7.13 lakhs beds in government hospital, roughly 30% are available in rural areas. Thus, people in rural areas do not have sufficient medical infrastructure. Then from this one we can understand that in rural areas very less facilities. Then especially there are only 0.36 hospitals every 1 lakh people in rural area, while in urban areas 3.6 hospitals in the same number of people. Okay, the PHCs located in rural areas do not even offer X-ray or blood test or like that facilities. State like Bihar, Madhya Pradesh, Rajasthan, UP, they are lagging behind in healthcare facilities. In rural areas, the percentage of percentage of people who have no access to proper healthcare facilities has increased over the last few years. Means very less people only getting proper healthcare facilities. Okay, villages have no access for specialized medical care like pediatrics, gynecology, anesthesia, cardiology. That very less facilities. Even though 530 recognized medical colleges produce about 50,000 medical graduates, every year the shortage of doctors in rural area is very high. Okay, means in rural areas doctors availability is very less. Okay, one study points out that 20% of Indians living in both urban and rural areas and spend 12% of their income in healthcare, while the rich spend only 2% for the healthcare.